coronary artery disease is quite prevalent, impacting many lives globally. Dr. Smith, can you elaborate on how plaque buildup specifically leads to heart complications?
Certainly, plaque accumulates in the coronary arteries, consisting mainly of fats, cholesterol, and other substances. It's like debris in a pipeline, reducing blood flow to the heart muscle, often resulting in angina or even heart attacks.
It's clear that lifestyle factors like diet and exercise play a role. However, do you think genetic predispositions sometimes overshadow these preventive measures?
While genetics do play a role, studies show lifestyle changes can significantly lower risk. A friend of mine reduced his cholesterol levels dramatically with a plant-based diet despite his family history of heart disease.
That's illustrative. Yet, critics argue that relying solely on lifestyle changes in genetically predisposed individuals might not be sufficient. What's your take on this?
It's a valid concern. However, coupling lifestyle changes with regular medical monitoring and, if necessary, medications can create a comprehensive prevention strategy. Looking forward, personalized medicine could bridge the gap between genetics and lifestyle.
Heart failure is another major concern, often linked to conditions like hypertension and coronary artery disease. Dr. Johnson, how do these factors interplay to exacerbate heart failure?
Indeed, they create a vicious cycle. High blood pressure, for instance, forces the heart to work harder, weakening it over time. It's akin to overloading a machine regularly, which gradually wears it down.
It's interesting how interconnected these factors are. But can patients realistically manage all these contributing factors simultaneously?
A patient I treated, Mrs. Patel, effectively managed her heart failure by controlling her blood pressure and maintaining a heart-healthy diet. It wasn't easy, but her efforts significantly improved her quality of life.
Some argue that such control is only possible with robust healthcare support, which is lacking in many areas. How can we address this disparity?
True, access to healthcare is crucial. Community-based initiatives and telemedicine are promising ways to support patients remotely. As we advance, integrating AI can also play a crucial role in monitoring and managing heart conditions.
Arrhythmias, or irregular heartbeats, can range from being benign to life-threatening. Dr. Ellis, what typically triggers these arrhythmias?
Arrhythmias can result from heart disease, electrolyte imbalances, or even excessive caffeine. Imagine your heart as an orchestra. If one section is offbeat, it disrupts the entire symphony.
So, not everyone with arrhythmia will face severe consequences. Is there a reliable way to foresee which cases might escalate?
True, not all arrhythmias are dangerous. In one case, a young athlete came in with palpitations due to energy drinks. Cutting those out resolved the issue. However, ongoing monitoring is essential for predicting potentially dangerous arrhythmias.
Yet, there's a debate around prescribing medication for mild cases. What are your thoughts on this approach?
It's a nuanced topic. Medication can prevent escalation, but it's imperative not to over-medicate. Personalized risk assessments will become increasingly critical as predictive analytics and wearable technology advance in medical applications.
Hypertensive heart disease results from chronic high blood pressure, yet is often asymptomatic in early stages. Dr. Naylor, how can individuals effectively monitor and tackle this silent ailment?
Detecting it early is key. Regular blood pressure checks are essential. It's like checking your tire pressure, ensuring everything runs smoothly. Many digital devices now allow for at-home monitoring, offering real-time insights.
What about lifestyle factors? Given our fast-paced world, is dietary management truly attainable for most people?
Absolutely, although challenging. A patient of mine shifted gradually, incorporating more fruits, vegetables, reducing salt intake, and he documented improved pressure readings within a year. Incremental change matters.
Critics might argue that these priorities aren't feasible for everyone, especially in low-income settings. How can technology alleviate these constraints?
Innovations like low-cost nutrient monitoring and community programs can offer support. Moreover, as technology advances, more scalable interventions will become available, ideally bridging socioeconomic gaps.